Thank you, Mr. Chairman. I appreciate it. Again, on the 66,000, the prediction, Dr. Petzel. Well, describe the benefits of enrolling in the VA as opposed to an exchange, because a lot of these veterans are already eligible. Give me an explanation as to why they would want to enroll in the VA as opposed to taking an exchange.
Thank you, Congressman Bilirakis. Sure. It's going to depend upon the individual veteran circumstance. So let's take an example. Let's take an example of somebody who is a Priority 8 veteran, is eligible to enroll in the VA. That individual is going to have co-pays and other things within the VA system. And that would, the amount of that would have to be weighed against what the plan that he was enrolled or she was enrolled in at the exchange offered. It would be, it's a veteran by veteran decision. And you would then have to also take into account accessibility, availability of services, et cetera. It's very hard to predict any given individual. I can tell you, I think without question, that the service-connected individual who basically would have no co-pays and no expense for VA health care would very unlikely to be enrolling in a program in the exchange, because there's just so much more value associated with that VA health care. But other individuals, it would be a veteran-by-veteran decision.
Okay, well, how did you come to this conclusion? I think it'll be more than 66,000 as well. But how did you come to that conclusion, that net increase? How did you base that? How did you base it on? In other words, the quality of health care in the VA? Give me elaborate a little bit on that.
Congressman, I will. Obviously, we couldn't interview and talk to each one of those million veterans that we think might be coming to us or not coming to us. Excuse me. We looked at the National Survey of Veterans, which gives us information about what veterans do and what their choices might be. The Survey of Enrolled Veterans, which gives us good information about the experience of the people that are already with us, and you can match what they do and their choices against their income and a number of other demographics. And we looked at the American Community Survey, which is the census survey that has questions on it that relate to veterans. The best information sources about what choices people might make that we have available to us. I would ask just briefly if Ms. Vandenberg has anything to add to that, because her office is the group that did that.
Just building on what Dr. Petzel just outlined, we've also engaged with our consulting actuary, Milliman, who is assisting us in understanding veteran behavior relative to the public at large. They're doing a lot of work for other clients who are assessing the implications of the Affordable Care Act. And so we've drawn on some of their insights regarding what causes a consumer to make choices regarding coverage, cost, et cetera. So those are the resources that we've employed.
Thank you. I have one question, one last question. Dr. Petzel, in your testimony, you outlined 3 areas to help enhance the veteran's experience with the VA, including, I know you touched on this a little bit, including providing each enrolled veteran with a personalized health benefits handbook, expanding call center hours of operation, and streamlining the VA enrollment application form and process. We are now less than a year away from full implementation of the ACA. Where in the process is the VA for each of the 3 enhancements mentioned in your testimony? When will they have access to it?
Thank you, Congressman Bilirakis. The benefits handbook is done and out. The streamlining the enrollment, I think, is in process and probably is close to being done. I think the most important part about this, though, is the information outreach effort, which we plan on rolling out in May and June in concert with Health and Human Services rollout about their information about ACA, the Accountable Care Act in general. And maybe if we could just take 30 seconds, Lynn, and go through the educational and outreach documents that are about to be going out.
Certainly. With our enrolled veterans, in addition to that tailored Veterans Handbook that we just spoke about, we're rolling out some...
The veteran will have access to the handbook.
The handbook has already been...
It's already done, but when will the veteran have access?
That's correct. We're wrapping that up. We've sent out almost 8 million handbooks.
Okay.
We will continue mailing out new books to new enrollees as they come on board. In addition to that, we'll be mailing out that one-time letter to all of our existing enrollees, reminding them of their health care benefits with VA, as well as any information about the tax credits and things that they may need to do. We are also embarking on making changes to our websites. That includes va.gov, My Healthy Vet, and the eBenefits portals. We have social media that is being developed, Twitter, Facebook, as well as our customer support, our call center. We have trained agents that are ready to address veteran and beneficiary inquiries. And we have printed materials that are being developed. Those include things like posters and brochures and fact sheets. Those will be ready for dissemination at our points of service. That includes both our VBA regional offices as well as the VA medical centers and our CBOCs. And the material will be available to be downloaded from the web.